Today we're talking about tension headaches. However, we aren't talking about the tension headaches caused by stress, the tension headaches caused by being hunched over a computer, or tension headaches caused by holding stress in your neck, shoulders, or upper back. Rather, today we are going to be talking about tension headaches that come from your eyes. These headaches are also typically called eye strain headaches and typically come from straining your eyes for a long period of time. However, this isn't necessarily an eye issue, rather it's an eye muscle issue. That being said, if you frequently get headaches, notice dizziness, blurriness, or anything else, go see a doctor. This is not medical advice, but rather information. Let's get to it. What happens when a tension headache occurs is that the muscles aren't able to fully relax when they should be. When it comes to tension headaches, many of us hold stress in our neck, in our shoulders, and our upper back. The muscles essentially become programmed to not relax. If we're continually put into situations we are stressed and bring ourselves into that hunched over or more rigid position, this inability of the muscles to relax essentially causes delayed onset muscle soreness or DOMS. The muscles aren't able to relax, which then leads to a hypersensitivity of the muscles and the structures it connects to, leading to tension headaches. For individuals with chronic tension headaches, there is a sensitization seen of the neural structures, meaning that because of the regularity of the stress, the pain pathways in the receptors have a lower threshold to provoke pain, so a smaller amount of tension or stress in the muscles causes the tension headaches to go from infrequent to chronic. There are other mechanisms involved, but that's the basis of tension headaches. You can read more on headaches by clicking the link below. Much like how tension headaches work, eye strain headaches are believed to work the same way. There are 6 pairs of muscles that control the movements of the eyes: the medial rectus, which brings our eyes inwards, the lateral rectus, which brings our eyes outwards, the superior rectus, which brings our eyes up, the inferior rectus that brings our eyes down, the superior oblique, which brings our eyes out, down, and internally rotates the eyes. The inferior oblique muscle brings our eyes in, externally rotates, and brings the eyes up. When we hyperfocus on an object, say a computer, for a long period of time, it can put strain on the muscles of the eyes. Let's say you have a computer that is right in front of your face. Your field of view is right here, so you're primarily using the medial rectus muscles to bring the eyes inward. This will cause shortening of these muscles and a prolonged lengthening of the lateral rectus muscles. An overuse of any muscle can cause it to get sore and cause that soreness. The issue with the eye muscles, though, is their relationship with the trigeminal system. When this pain occurs for extended periods of time, it can cause pain signals or nociceptive signals to be sent to an area in the brain called the trigeminal nucleus and activate other pain pathways as well. This can lead to feeling of a headache behind the eyes, a headache that seems to come from the base of the neck, or a typical tension headache that seems more of that band-like in appearance or in feeling. That's what happens. Now what? Obviously, a long-term solution focused on correcting the issue or helping the body become more resilient is the best method to deal with this. However, there are things that we can do to help relieve those muscles. The first, take a second to look away from the computer screen. Take 2 minutes to look at something far away. You have the time. You deserve a 2-minute break from staring at your computer. The second thing is palming. Palming is the very light application of pressure, less than 12 ounces, to the closed eyes for 1 minute, followed by looking in 5 different directions while maintaining the light pressure. Here's how it's done. I like to rest with my elbows up on something and then bring my palms towards my eyes, and then very gently apply my palms to my closed eyes, and then with a light pressure, maintain that pressure for 1 minute with the eyes relaxed. After the 1 minute is followed by maintaining this light pressure, looking left for 10 seconds with your eyes, right for 10 seconds with your eyes, straight ahead for 10 seconds, down 10 seconds, up for 10 seconds, and then relax. Your eyes might be blurry for 10 to 20 seconds after doing this. Individuals can do this up to 10 times a day, but need to wait at least 10 minutes between the time they do it. Also, in some individuals who have a lower threshold for headaches, sometimes the palming of the eyes has the potential to induce a headache. This video is an informational video and not medical advice. I hope you enjoyed this video and found it beneficial. I can always be reached at drkaufman@optimizecolumbus.com, and please like, subscribe, and share. You can also check out more information about our data-driven chiropractic approach by visiting our website at datadrivenchiropractic.com. And of course, I want to say thank you to all of the researchers that spend their lives in a lab learning about the human body so that we can apply it and help people live better, healthier lives. Have a great day.